This is a 50 years old male who is a known case of chronic smoker and diabetes and hypertension. Presented to the emergency department on this Sunday with ST elevation in 2-3 AVF with the reciprocal changes in the 1 AVL. Patient was in the continuous chest pain, so we took up for the angiogram, and this is angiogram. This is a LO caudal view, and you can see the normal LAD, short left main with normal, and LAD and this LCX. And this is a cranial view, and you can see the normal LAD, how long the LAD is. Type 3 almost around wrap around the LAD at the apex. As the patient was in hypotension and there was a very feeble pulse in the radial, we tried for the radial, but there was no access through the radial artery, so we had to do with the femoral. So whenever we do femoral, we take one shot of the renal, as the patient is a diabetic and the chronic smoker. So this is a left renal artery. You can see normal ostium of the left renal artery. You can see almost diameter is 8 to 10 mm in the proximal renal artery. This is a left renal artery, and this is a right renal artery. So both renal arteries is normal. There's no stenosis. So as expected, this is the RCA, and you can see how bad thrombus is there right from the proximal to mid RCA. And this was the cranial view, and you can see is almost 90 to 95% stenosis, thrombotic stenosis. So after obtaining the all clearances, we proceeded for the angioplasty. This is a JR catheter with side hole, and this is a BMW PTCA wire. So it was cinched to cross the lesion. So being the long lesion in the RCA, we decided to put a 2 stent because we didn't have more than 40 in length stent. So this was the mid RCA stent. It is 3 into 28 mm. And this is a stent inflation at around 14 atmospheric pressure. RBP was 16, nominal was 8. So after inflation of the stent, it seems that there is under expansion of the stent. So we did the NC afterwards. And this was the proximal RCA stent which we overlapped. So this was the deployment of the stent at around 14 atmospheric pressure. The RBP was 16. This is a 3 stent, 3 into 20. And then we overlapped the stent and did the NC. And this is the scene after this primary angioplasty to the RCA. And this is the final scene after the NC. So this was the primary angioplasty to the RCA. The patient was in a first degree heart block, but then you can see all branches has been saved, and this is the TME3 flow. So we shifted the patient to ICU and the patient was stable. There was no hypotension and nothing.